Hi guys, I'm gonna talk about the spinal cord stimulation. It might not be that much cool, but if you're interested, I promise to be brief. My main references are the book Neuroengineering by Dilorenzo, 2008 CRC Press. The 7th chapter of it is about the spinal cord stimulation, written by Burton and Phillip Phan. And there are two articles that are my reference also: the Spinal Cord Stimulation Principles of Past, Present and Future by Kunnumpurath, 2009 Springer Series, and Neural Interface Devices, Spinal Cord Stimulation Technology by Richard North, IEEE, 2008. What is a spinal cord is that it provides electrical signal to the spinal cord to control pain. And nowadays these electrodes of a spinal cord stimulation are implanted in the epidural space. I have plenty of pictures here, let me show you them. Okay, so this is the epidural space, the target place of the electrodes. And SCS, spinal cord stimulation, or SCS as I call it from now on, comprise of a generator which provides the electrical signals, the conductive leads, and the implantable stimulating electrodes. The electrodes come in two types: catheter types or percutaneous types, and paddle or surgical types. The percutaneous types are shown here, and the range of the dimensions are shown also. The paddle types comes in different shapes, with 3 arrays of electrodes or 2 arrays, and their typical dimension. The percutaneous type procedure, which a small area over the spinal cord is pierced, and it can be several areas, of course, but for the implanting the paddle types, the tissue above a spinal cord needs to be incised, and sometimes the laminectomy is needed. The generators for a spinal cord come in 2 categories: the implanted pulse generator and radio frequency receivers. The implanted pulse generator has battery and microprocessor, everything inside of it. It is implanted inside of the body, and the radio frequency receiver is just a receiver that is implanted inside of the body, but the transmitter which provides the electrical signals as well as the power for this radio frequency is just outside of the body. The IPG implantation, which is implanted pulse generator implanted inside of the body, and the generators, the IPGs needs a battery, so the battery will run out and needs to be recharged. Usually, if the battery is not rechargeable itself, there is a surgical operation, necessary surgical operation. And but the RF receivers does not need any surgical operation. They are externally driven by a transmitter, both in power and signal, and they are traditionally being used for patients that require high power settings that would quickly deplete the primary cell IPG. The generators usually have a remote control for the patients to allow them for limited programming of the stimulation pattern, and a programming device for the surgeon to modify a wide range of stimulation settings. These are implanted IPGs and radio frequencies made by Medtronics or Advanced Bionics with their controls. Typical patterns of coverage of SCS are just shown here, depending on which size of which area of the body is in pain. The electrode is implanted accordingly. Okay, it's finished. The pictures. So. The SCS procedure begins by careful placement of electrodes in the epidural space, and a trial period of between 5 and 7 days are followed after, and if it's positive, if the result was positive and pain-revealing, electrodes are anchored to the interspinal ligaments, and the IPG or RF receiver is positioned, and then the wires are tunneled and connected. There are a lot of materials in literature about insertion techniques and considerations. These materials include consideration about the placement of electrodes, selecting the level of stimulation, electrode type, paddle one or percutaneous one, implantation of IPGs, programming the whole system, adjusting the amplitude, width, and frequency. The amplitude is usually between 0 to 10 volts, or the width are between 100 and 400 microseconds, and frequency between 20 and 120 hertz. And the cycling of the whole system to be very much pain relieving and save the battery life. And also the post-operative care is just mentioned in literature. SCS is usually used for failed back surgery syndrome and peripheral ischemia and angina. And advantages of SCS is that it is on demand, analgesia is on demand. When the useful traditional options of therapy fails, this SCS could be employed. And it avoids side effects of pharmacotherapy, and there are no restrictions in daily activity. Disadvantage of SCS is that it's only effective in 50 to 70% cases, and it has invasive procedure, consecutive circumstances, and it's more expensive. It requires regular check, and there are a lot of material again in literature about patient selection, that patients should fail the conventional therapies, and the trial should be successful, and the patient should be psychologically okay. And also there are good statistics in Dilorenzo book about the failure rates, and the reported complication like infection or electrode migration, fraction of the electrodal rotation of IPG, or even the puncture, dural puncture headaches are reported in literature. Mechanism of action of SCS is still unclear, like mechanisms of actions of the neural system stimulation. But the probable theories are that in summary, in neuropathic pain, SCS provides suppression of abnormal hyperexcitability of the dorsal horn neurons, and in ischemic states, SCS brings restoration of oxygen demand supply, and it does that by inhibition of sympathetic system or vasodilatation, or a combination of that. The future things in SCS is that it can be provided in Parkinson's disease, it can be provided in simultaneous stimulations like spinal cord, nervous roots, and peripheral nerve. And more complex and more power efficient microprocessors can be developed, and closed loop biofeedback systems can be developed that record the neural responses after stimulation and fix their performance accordingly, and the costs should be reduced, and new modes of pulse waveform can be employed, and SCS can be combined with implantable drug delivery system, and also the mechanism of action can be taught and hypothesized and examined. And that's it. Thank you.